Have you ever pondered the weight of a memory? How can an event, once lived and past, hold such power that it continues to shape a person's life, thoughts, and emotions years later? This is the stark reality for individuals living with post-traumatic stress disorder, or PTSD, a mental health condition that manifests after experiencing a traumatic event. Understanding PTSD is not a simple task, as its impact varies uniquely for every individual. It's a complex puzzle, interlocking symptoms, triggers, and therapeutic interventions. But to truly comprehend the struggle, it's crucial to start with the basics. Symptoms of PTSD are as diverse as the individuals it affects. They can be categorized broadly into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Intrusive memories are unwelcome, often vivid recollections of the traumatic event. They may come in the form of recurrent, unwanted, distressing memories, or even nightmares. Some individuals may experience flashbacks, feeling as if they are reliving the traumatic experience. Avoidance is another common symptom. To escape the distressing memories, individuals might avoid places, activities, or people that remind them of the traumatic event. This is their mind's attempt to erect a barrier against the painful past. Negative changes in thinking and mood might seem less tangible, but are no less real. A person may harbor negative thoughts about themselves, other people, or the world at large. They might feel hopelessness, struggle with relationships, or lose interest in activities they once enjoyed. Changes in physical and emotional reactions, also known as arousal symptoms, can include being easily startled or frightened, having difficulty sleeping, or exhibiting aggressive behavior. Now, it's crucial to understand that these symptoms don't exist in a vacuum. They interact with triggers, which are reminders of the traumatic event. Triggers can be anything: a sound, a smell, an image, a person, or a place that brings back memories of the trauma. But here's the silver lining. PTSD is not a life sentence. There are therapeutic interventions that can help individuals cope with trauma. Cognitive behavioral therapy, or CBT, helps individuals learn to identify and change thought patterns that lead to troublesome emotions, feelings, and behavior. Exposure therapy assists in facing and controlling their fear by exposing them to the trauma they experienced in a safe way. On the other hand, eye movement desensitization and reprocessing, or EMDR, is a relatively new therapy that has shown promise in treating PTSD. It involves focusing on sounds or hand movements while talking about the traumatic event, which can alter the way the brain processes memories. However, none of these interventions can begin without the first crucial step: seeking professional help. It's important to remember that reaching out is not a sign of weakness, but a testament to strength. It's the first step in regaining control, the first stride towards a future where the past no longer holds power. Post-traumatic stress disorder is a heavy burden, a testament to the profound impact of past trauma. But with understanding, intervention, and professional help, it's a burden that can be lightened. Remember, the weight of a memory doesn't have to shape a lifetime.